Okay, starting right.
The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. Thanks for joining us. We'll get started in just a minute. We'll give people a couple more minutes to get on the line. Hi, everyone. Good afternoon. Welcome to the webinar. My name is Katie Byerly, and on behalf of the Kresge Health Program, I'd like to thank you all for joining us today to learn more about our strategy. Today, you'll be hearing from the whole team, and we'll get to some introductions in a moment. Before we get started, we just have a few housekeeping notes to review. Everyone is placed on mute for the webinar, but we'd still love to hear from you. So you can submit questions at any time throughout the chat feature, and we'll be getting to questions at the end of the webinar. The webinar is being recorded, and the slides and the recording will be shared afterwards with attendees. So you will get the slides following the webinar. So today we're really excited to share an update on our program strategy. All of you, our partners, have been critical to advancing health and well-being through your work, and our program continues to build on those lessons and successes from the field. Today we're going to give you a brief overview to the Kresge Foundation and the health team. We'll share how the health program's work is evolving based on what we've learned in our past decade of grant making. And as I mentioned before, we'll be answering questions at the end of the webinar. So please feel free to ask those questions at any time through the chat box. And with that, I'll hand it over to David Fukuzawa, the Managing Director of Kresge's Health Program.
Thank you, Katie. And I'd like to extend a warm welcome and thank you for your interest in the Kresge Health Program. And good afternoon or good morning to you, depending on where you are. And if you're calling in from or ringing in from Hawaii, aloha, and hope it's warm enough in Alaska. It's chilly here in Michigan. So a little bit about the Kresge Foundation. As many of you know, we're a national private foundation with an endowment of $3.6 billion, and we fund through both grants and social investments. The health program is one of 6 program areas, and there are also what we call practice of social investment, and also the American Cities Practice Program. I'd like to move quickly to just letting you know who else is on the team and on the call. Besides myself, I'm joined by Chris Cable, Deputy Director, Phyllis Meadows, Senior Fellow, Stacy Barber, Senior Program Officer, Laura Lamberty, our Program Team Assistant, Katie Byerly, who is our Health Fellow. Dexter McKinney handles our grants management under the title Program Operations Information Management, and Christine Karras is our Communications Officer. And you'll be hearing from some of them later on in today's webinar. So let me begin by explaining to you, and hopefully allaying a little bit of anxiety about changes in our program strategy. I know, and if I may just add, that a lot of people in the nonprofit world, rightly or wrongly, accuse foundations of switching their strategies kind of at will. And I will admit that many do, but we are actually required by our board to review our strategy every 3 to 5 years. It's a regular part of our process, and we believe it allows us to, allows both the team as well as the trustees and our executive team to take a good hard look at what we've done and what we've accomplished, what's changed in the field, and what we've learned. And the strategy is then presented to the board and is approved. Let me explain a little bit about the process. This is not simply our thinking about what we think is right. We talk to a lot of external experts. We had not only an analysis, we've had several analyses done of different parts of what's been going on within the broader public health and population health field. We did review our past grants and asked what lessons and achievements we've made, and looked at some of the key policy wins that we have advanced through many of you, our partners. And we consulted also with other colleagues here at Kresge. One of the things that many of you may not know, but I'm sure some of you do know, is that we do quite a bit of work with the other teams and practices here at Kresge, and they influence how we think and also identify opportunities for future and current work. So that explains the process. But this slide explains kind of the big lessons. There were many things that we learned as we went forward, but this is a way to kind of summarize the key lessons. One of the things that may not be so explicit here in this slide, though, is that we felt that after looking at the program over the last few years, and we really took a look back 10 years, not just the last 3 years, because in many ways our program has been fairly consistent over the last 10 years, even though we've changed program strategy titles. We've really been focused on advancing a broader work around health equity through a couple of main pillars. One pillar is through accelerating population health within the formal health system, but also addressing social determinants, especially housing, food systems, and the built environment and transportation. But starting from the outside, one of the things at the bottom left-hand corner, we realized that one of the key things that emerged throughout all of our work, in probably every sector and at every level, was the need for a new kind of leadership to move into health equity, because it requires both a different vision, it requires a readiness and a certain set of values, and it, in many ways, requires a different kind of practice. And we also realized that we must continue to focus on policy development, if we're going to change. Obviously, since a year ago, almost today, the policy environment has radically changed, which means that we think we have to be even more committed and more strategic as we think about policy. The upper right corner, we will continue to focus on cross-sector solutions. We think the fields have begun to move in this direction. We want to continue to emphasize that. And in the bottom right-hand corner, we will double down on our efforts to work, especially with our social investments practice staff, on innovative financing. In many ways, the money is a key part of helping to get to endurable solutions. In the middle, what we saw are some of the bigger kind of changes within the field. These things have been going on, obviously, for a number of years, but we felt that there had been some real development and movement towards not just broad issue identification, but real solutions. So one of them is the move towards value in population health, especially around integrating health and human services. The other thing that was kind of a corollary to this was looking at how healthcare and other institutions, including financial institutions like CDFIs, were really increasing their investments to achieve social outcomes, to address social determinants, that we had to move beyond simply charity care in community health, hospital community benefit, to really creating real outcomes for people on the ground. And the work that we have been doing in many places and cities around the country, our place-based work around housing, food systems, and built environment, one of the things that we realized that we had it somewhat backwards, that it wasn't the issue, it was what the people were beginning to drive towards, that is real solutions on the ground, that we needed to recognize that in our strategies, and to elevate the role of communities in achieving real solutions for health in their communities. So that, I'd like to move on to our new broad statement of our strategy, which is we help to build equity-focused systems of health that create opportunities for all people to achieve well-being. And here we're simply putting equity front and center in all the work that we do. And in terms of the strategies, the new strategies are represented by the three circles around the equity-focused systems of health. So starting at the top left, strategy 1 would be integration of health and human services, and then the top right, institutional investment in community health, and at the bottom, community-driven solutions. And the key themes that we see kind of bringing all these things together, we realize that each of these, in terms of building the field around this, will require work around policy, both development and advocacy, leadership development, continuing to build new partnerships, and looking at innovative financing. And I know that many of you are wondering, what do those mean? And that's what we're going to go to next. So with that, I'm going to introduce Phyllis Meadows, who can talk to you about strategy around integration of health and human services. Phyllis?
Thank you, David. Well, good afternoon or good morning. I'm really delighted to be able to share with you today the one of three major strategies that we've outlined in the health team to advance our work over the next several years. I've been asked to provide a brief overview of the strategy that, as you will see, will focus on the integration of health and human services. As David shared earlier, we've developed this strategy in partnership with our grantees, but our efforts are primarily focused on accelerating those efforts that build more seamless and effective systems that can be sustained over time and can address the foundation's goals of economic mobility and improved health outcomes for individuals, families, and communities. This strategy will be implemented at the foundation as a joint effort between the human services and health teams. This is new work for us, so we're learning by doing, but we also feel that if we're asking for you to work in more strategic ways, that we as a foundation need to do that as well. Over the past several years, each of our teams have made considerable investments in projects that have sought to initiate, build, and strengthen multi-sector collaborations to promote well-being in communities. As David said earlier, our intent is to build on this work. We're not making great strides in different ways, but we want to accelerate the great work that we see already emerging in communities, and mainly to move beyond the wonderful collaborative efforts that have evolved over time to more integrated practice, policies, and systems. Through numerous conversations with our current grantees, professionals and practitioners in the field like you, and more importantly, in listening to the voice of community, those who are using health and human services, we've become aware of a number of challenges. From organizational barriers that make it difficult to share needed client information, sometimes within the health and human service agencies, and more often across multi-sector partnerships and organizations, some that coexist together in communities, and some that are mutually serving the same clients. What we'd like to make sure is that through this investment, that we will support those agencies who are critical to assuring that children and families have access to comprehensive services they need in a seamless and timely and effective manner. We also understand that those of you who might be leading efforts, whether in health or in the human service sector, often share the same goals, but are not always clear about how to navigate and leverage the approaches and interventions to maximize the services you provide, quite often to the same clients. We've discovered and seen some examples of wonderful models emerging across the country, where health and human service agencies have begun to bridge programs so that families have access to multiple services regardless of where they enter the system. We've also seen programs create universal intake processes, but are struggling to make those processes work or to move the data and information in a way that really serves the client in the most optimal fashion. We've seen agencies work on cross-training of staff for multiple functions, and a number of programs are tackling the constraints of challenges around basic data sharing and communication across sectors. Our vision and our aspiration in this work is to support those agencies who are working in this space, who are beginning to tackle the problems of more integrative practice, and to strengthen their capacity and move their capacity for maximum reach and greater quality in the level of the services they provide. Our plan in rolling out this strategy will seek to support agencies and leaders who really have a vision of moving beyond partnerships and collaboration to advance and accelerate their current integration efforts. These integration efforts might include things that involve strengthening their systems, their practices, and their policies to achieve greater impact for families and communities. The investments within this strategy will focus on reaching and supporting those who are in the midst of this work, who are currently trying to move towards integration. This includes addressing the policy barriers, who are the agencies that are creating data sharing practices and designing ways to communicate better across the sector, and those who are building more effective systems within the organization and across the community to allow families to get what they need in a more efficient and less burdensome manner. Within this strategy, we will focus largely on efforts that are not in the partnership building stage, but organizations who have effective and solid collaborations but are moving towards integration. We're seeking to support grantees that have formal multi-sector partnerships, yet need to create more effective and sustainable operative systems. We believe that leadership development will be an essential aspect of our investment, helping leaders within the health and human service sectors better navigate multi-sector engagement and to learn how to better leverage and advance the services, integrative services provided to children, families, and communities. So in summary, what we hope to see over the next several years are clear models of integration that deliver impact on the health and well-being of families. We will be investing through our joint partnership with Human Services in building infrastructure with existing programs and strengthening policies and practices within and across sectors. And again, we'll be preparing leaders and organizations to work effectively across sectors to impact health and human services. I know we've planned for questions at the end of the presentation, so I'd like to turn it over to my colleague, Chris Cable, who will be sharing our second strategy.
Thank you, Phyllis, and thanks again for everybody who's joining us on the webinar today. In explaining our focus area on leveraging institutional investment, I'd like to address three main points. Number one, what we mean by community investment, including our institutional investment, including a couple of practical examples. Number two, why we feel this strategy is important. And number three, why our approach will encompass both institutional and community perspectives. So the first point concerns the scale of resources that can be repurposed to improving community health. Hospital systems, universities, local governments, and others, who are often termed anchor institutions, control billions of dollars of investment, purchasing power, real estate, and other assets. In too many cases, these assets and activities are not fully aligned with their missions. Nonprofit hospital systems alone hold more than $500 billion in their treasuries and endowments. This amount dwarfs the roughly $3 billion that these systems make each year in grants to fulfill their community benefit obligations, which typically garner a lot more attention. One example of how health systems can invest in their communities is Dignity Health, the nation's 5th largest health system with hospitals and facilities in 21 states. The investment policy set by Dignity's board allows up to 5% of assets from funded depreciation to be used for community investments, and thus far more than $100 million has been allocated. In addition to providing secured and unsecured loans, guarantees, and lines of credit, Dignity also makes below market rate deposits in credit unions and CDFIs to enable them to make small business and affordable housing loans. Dignity also invests in loan funds such as Healthy Futures Fund, Living Cities Splendid Catalyst Fund, and the California Freshworks Fund, all of which are dedicated to improving opportunities for low-income people. Our efforts to leverage institutional investment will not be limited just to hospital systems. One other example of such investment is United Healthcare, which is one of the largest insurance companies in the country with 37 million covered lives. In addition to providing traditional employer-based health plans, United also operates Medicaid managed care plans. Through their Medicaid managed care plan in Arizona, they came to learn that the availability of stable, affordable housing was one of the biggest social determinants of health affecting the lives of their Medicaid population in Phoenix. As a result, United made a $22 million low-interest loan to Chicanos por la Causa, the largest community development corporation in the state, to acquire and renovate more than 500 apartments as part of a new community services center in Phoenix's Maryvale neighborhood. This center integrates housing, healthcare, and supportive services such as workforce development. So over the next 3 years, we're going to work to help make these case studies more of the norm rather than the exception. For example, we're currently supporting the Center for Community Investment, together with Kresge's Environment Program and American Cities Practice. The center's team will be working both with healthcare systems and with multi-sector collaboratives in 8 to 10 cities to help shift institutional investment to where it can improve the well-being of low-income residents. The next point I should emphasize is that there are two sides to this investment equation. In addition to influencing how institutions think about their community investment role, we need to build the knowledge, capacity, and sophistication of community-based organizations to access those resources and deploy them to achieve substantial impact. To many community-based organizations, institutions like hospital systems, universities, or school districts can seem rather opaque, with few access points and opportunities to influence their behavior or their investment. We aim to improve the capacity of a range of community-based organizations to partner with institutions to achieve shared goals. One of the ways we're currently doing this is through the Build Health Challenge, which you see highlighted here on this slide, which supports collaborations between community, public health, and healthcare in 18 cities around the country. We see this strategic pillar on institutional investment as complementing and supporting our other two focus areas. At this point, I'd like to turn it over to Stacy Barbas, who will introduce our community-driven solutions strategy.
Thank you, Chris. Hi, everybody. Thanks so much for hanging in here with us today. I'm going to talk about the final leg of our framework, which is community-driven solutions for health, and let you know how we're thinking about that. And then I'll turn it back over to David, who's going to wrap things up for us. And then, of course, we've left time for any questions that you might have. So I think you've heard from my colleagues, from all of them, that this revised framework is really sort of a fine-tuning and an extension of our previous work, and it's obviously based on what we've learned over the past many, many years. So the community-driven solutions area is really an evolution of our two previous strategies, our really early program area called Healthy Environments, and our most recent Developing Healthy Communities focus area. Both of these strategies had a really explicit focus on determinants of health, and most recently on housing, equitable transportation and land use, and food systems. So as an example, you might remember or know about under our housing strategy, we implemented the Advancing Safe and Healthy Housing Initiative. This is a 4-year initiative where we worked with 6 communities around the country who are addressing not only lead but other toxins in homes, and also developing policies that would continue to address the issues of substandard housing in those communities. Needless to say, we learned a tremendous amount from these phenomenal projects and others, and those are helping us to shape our future work in housing and health. And then a little over a year ago, while we hadn't implemented our new strategies yet, we were just starting to think about them, we launched a new initiative called Fresh Flow, which was really a preview of our thinking in this area. Fresh Flow, which stands for Fresh, Local, and Equitable, is a fairly comprehensive community development initiative in 23 neighborhoods around the country, where communities are using food and creative placemaking to really help increase economic activity and, of course, improve health outcomes and improve conditions equitably in those communities. And how each community is doing that is driven by members of that community. So over the years, we've tested lots of assumptions and we've learned a lot. I mean, most explicitly that we, of course, know and respect that communities have the answers to their challenges and solutions much better than outside experts do. And that we also know and have learned that solutions to address neighborhood priorities are far more equitable and sustainable when they're created by the residents and the community members. And we also have learned that even though there might be a very specific nature of local community conditions, successful community-driven solutions, they can create models of community change that can be adapted elsewhere. So we took these learnings and implemented Fresh Flow for One as one of our very new early examples of this work. So under our new community-driven solution strategy, some of the previous determinants I mentioned will still be prioritized, but in a more targeted and refined way. And we'll shift our focus more on the approach, so really central, which is really central to addressing health outcomes and developing solutions. So we know that we will continue working with some of our current partners, and we also anticipate working with new partners whose work aligns with their strategies. So when the funding opportunities are rolled out, the pieces that will have particular emphasis and we'll really be looking at is are they representing genuine community priorities? Are they building community leadership and power in the process? And is there also a blending of disciplines or a cross-sector approach? So finally, we do anticipate focusing on improving housing stability and affordability through local policy change, supporting communities in ways they're working to drive health development, equitable policy systems and practices, and our aspirations is increasing the adoption of inclusive community-driven models that address community conditions such as housing and food systems. So we ask that you please stay tuned to hear more as we roll out this area in the near future. I'm going to turn it over to David.
So let me try to summarize a little bit here, and thank you to Phyllis, Chris, and Stacy for describing each of the new areas. To tell you a little bit about how we think about it, what's behind our new approaches, and one is clearly, as we want to emphasize equity, this is really the root and soil in which we believe will have to arise. If we can't achieve equitable solutions, then the solutions really in the end are not going to achieve the kind of impact that we want. So when we use the word accountability, we speak not only of the work on the ground, but of ourselves also, to think about how can we achieve real value and real outcomes in the work that we do. And we want to leverage what we think are some things, some fence posts of the work. Clearly, when we think of anchor institutions, as Chris explained, that is a key leverage point, largely because of the assets they hold and the fact that they are such important institutions within communities. We will hold to the Kresge Urban Opportunity Framework in seeing cities and communities as really places where social innovation is happening. But we also want to elevate both the role of leadership at all levels, in driving solutions. So I would, as I think about these things, I think that what's changed for us is really driving towards solutions and seeing real outcome-driven kinds of approaches in all the grant making that we do. So we're going to move to Q&A shortly, but we do want to say, because many of you are saying, okay, so how do I get the money? And believe you me, we were very aware of that issue, and we don't have a clear answer for you now, but we do promise that we will make these opportunities available as we go forward. So we urge you to subscribe either to our weekly updates or to just check in regularly at kresge.org/opportunities. to see, what our grant funding opportunities are. So with that, and I'm reminded here also that that there are some things that are already on deck, especially for those of you in the public health world. So you should be aware that the third round for our Emerging Leaders in Public Health Initiative, or ELF, the call for applications will open on April 2nd. So you can follow that at kresge.org/ELF for more updates. So with that, I'm going to go back to Katie, who opened up our webinar, and see if we can get to your questions and questions.
Great, thanks, David. We have a couple of questions that are already on deck, so we'll go ahead and get to those. But again, if you have additional questions, feel free, please, to type those into the chat box. Just to kick us off and kind of reiterate what David was saying, we had a question about grant-making guidelines. There are some guidelines already on the website for how the team makes grants and what we look for. And as David mentioned, those additional funding opportunities will be announced via our newsletter, website, and social media as they're developed throughout the year. We also have a question about leadership development, and I'm going to pass it over to Phyllis to answer that one.
Okay. Thank you, Carol, for this question in, and I'll just read it and then try to give my best answer to it and allow my colleagues to join in where they feel appropriate. And the question is, can you define leadership development, and does that include executive education? And I don't know if those are two questions from different people, but one question. Okay, so we probably use the language of leadership development to really encompass more specifically the development of leaders. We recognize, and through our discussions, that leadership development occurs across a continuum, from just basic activities to helping people understand and be aware of the issues, to the very far end, being prepared to take action. So we use that as a broad sort of umbrella term in really being able to respond appropriately to whatever the needs are, either within a strategy or even within a community. So we don't want to get locked into an absolute framework about leadership, but we are committed to assuring that leaders have what they need to advance their work in this particular area in integration. Does that include executive education? Well, again, there are many approaches to leadership, and we would want to see, from options of having institutes, summer institutes, or full-day conferences. There are different modes of delivering leadership development, and right now we don't have the specific areas that we've locked ourselves into, but we would certainly be open to that. We do that already through our Emerging Leadership in Public Health program. That is primarily sort of an executive leadership program, but we want to be open. I hope that answers your question.
So this is Chris, and we also received a question regarding eligibility for smaller rural communities. As David mentioned, Kresge is really as a foundation about expanding urban opportunity. The one through line that is supposed to connect all of our programs and practices is expanding opportunities for people with low incomes in America's cities. That said, Kresge's never set explicit population threshold by what we mean by city. I know in my grant portfolio, I think the smallest city in which I'm engaged is about 45,000 people. But we are pretty clear about we're not a rural funder, right? So there are going to be other funding opportunities that are probably going to be better matched for rural communities. That said, we do understand the challenges and pressures that are faced by a lot of rural communities, whether it's economic dislocation, whether it's the opioid epidemic, but Kresge is very clearly focused on urban opportunity.
Great. We have another question about evaluation, and Phyllis is going to take that one for us.
The question is, what is the role of evaluation in this upcoming work? I can answer that one really easily. central. We have, as part of all of our work, the expectation that we learn, but also that our grantees learn. And we believe that a major way of accomplishing that is through evaluation. All of our current initiatives have some form of evaluation embedded into them. And so, especially as we roll out new exploratory work, we believe that evaluation will be a critical piece of this effort.
Thanks, Phyllis. Our next question, David is going to take for us.
So this sounds like it might have come from a researcher, but I'll try to answer the question. Would you share some reflections about what surprised you in review and research of the field? So this is a great question. I think if I had more time to think about it, I might have different answers. But the thing that kind of popped in my mind right away, which I mentioned earlier, but Stacy also kind of expanded on it, is that as many of you know, we've been very focused on issues such as substandard housing, like healthy housing issues, environmental justice issues, food system issues over the years in terms of looking at social determinants of health. And we were very focused on problems or social determinants. But what emerged in all of this work, and even our population health work, was that what we were seeing was the emergence of a significant group of community-based organizations, community-driven kinds of organizations that were really at the forefront of creating real solutions on the ground. That what we had missed was that it was how communities were able to define those issues, and communities don't always. This is kind of a dumb moment because we all knew this, but communities don't see the issues on the ground in siloed ways. They see them across a number of different dimensions. And what tipped us off to that was the origin of our Fresh Flow work, which Stacy described to you. So Fresh Flow came about, it was originally going to be, I will tell you or confess to you that it was originally going to be a more traditional kind of food system access kind of work for communities, but in talking with our colleagues on the arts and culture team, we began to realize that communities were spontaneously bringing together placemaking and culture and ethnicity into the food work. Or we were seeing also community development organizations using food as a driver for development. So what communities were spontaneously doing were creating solutions which have no frame in kind of the traditional philanthropic world. And we realized that we had to go beyond those things and be able to define health very broadly in such a way that we could actually do this kind of work. And that was something which required us to really break out of a kind of way of thinking. So that was kind of one big, I think, lesson. The other was it was very clear to us, and we've been saying this on and on and on about the need for people development. So it's really what we mean by leaders, that this work cannot go forward without people at almost every position at every level in the work that we do, because it will require a different way of thinking, doing, and being in this cross-sector world.
Great, thanks, David. We are going to go to Chris next for a question about how we work with corporations.
Sure. So the question was, does Kresge work with corporations? The answer is yes. I mean, obviously, as a private foundation, our grantees tend to be nonprofit organizations or sometimes local governments, like local health departments. But we do work with corporations that I think are aligned with our values and our strategies. So one example is the Build Health Challenge. It's a publicly traded consulting firm, the advisory board that was a founding member of the Build Health Challenge and that helped co-design that and co-fund it. Other examples include We're involved with the Living Cities Blended Catalyst Fund. There are a number of representatives on that fund who represent the community development arms of major banks, so Morgan Stanley, Citi, and then Healthy Futures Fund, which was a $100 million fund that we participated in along with LISC, which is a major national community development financial institution, as well as Morgan Stanley, which you probably know is a major bank, that financed both the development of community health centers as well as affordable housing. So where we do see opportunities to work with corporations that are aligned with us, both in terms of value and strategy, we would welcome those.
Great, thanks, Chris. Next, we'll go to Phyllis for a question about the integration strategy.
The question is the integration component focused on families? And the answer to that is in part. We, as I mentioned earlier, the health team is doing this work in partnership with Human Services, and a focus on children and families is a paramount issue for them. When we think about integration, if you remember earlier, we talked about building on our earlier work. We've done a lot of investments already in the space of health and human sectors, broadly defined. And that includes areas such as housing and workforce development and all kinds of services that might lead families to economic mobility or improve health. So while families is an area that we will be emphasizing, it is not the only space where we see that integrative practice or policy happening.
Thanks, Phyllis. Great. Now we're going to go to Stacy for a question. There are a few questions kind of along these lines about how we work with partners to identify new ideas or develop new ideas. So Stacy's going to take that question for us.
And so I think that one of the questions that we have is, do we accept or encourage discussions and interactions prior to submissions? Well, I would like to say that we prefer to ideas that actually come through our system so that we have the opportunity to really work with you a little more. And I know that's not, and so when you submit a proposal, we do a lot of back and forth, lots of questions, a lot of, it's a very dynamic process. So once you submit, we certainly give you many opportunities to answer our questions. I will also say that we do have a mechanism that if you have a question about whether you think that it's the right proposal or not, you can email us and then we can send back an answer to you that lets you know if we're able to do that.
Great. Thanks, Stacy. David has a question about policy. So there were a couple of different questions about how we see policy fitting into different parts of our new areas. So we're going to kind of lump those together and talk a little bit generally about policy.
I do want to add just one little thing to what Stacy said. In that, you know, we're not starting over brand new, that we have a lot of existing partnerships, and we see this work as cumulative, and we're building on that. So we're not walking away from partnerships that we have clearly been invested in. But on policy,
David, before you go there, because I have a question that's also kind of similar.
Oh, great, yeah.
And it's just asked, how do we best share our work if we are not a grantee? And just to reiterate what Stacy mentioned, that, you know, we're not only just funding those projects that we know. We hope to engage new partners and new projects, but the best way to do that is when the funding opportunity is announced, is to get your proposal in.
Yeah. And we know that despite all of our efforts to, you know, to try to be careful about this, many of you will run into us and send us emails and things like that.
And we won't run.
Yeah. And, so we do talk to people because we are interested in new ideas, and we know that we don't have all the answers. So there were some questions about policy and one, how we see policy fitting into our new areas. And you know, as I said earlier, it is very difficult to see how we get to real systemic change, because that's really what we're about, without policy change. Having said that, we think of policy as both big P and little p. So while there are perhaps few big policy opportunities at the federal or national level. There's certainly some policy opportunities at city and state levels at which we will be taking a look at. But we are also interested in the kinds of policies which can, shape institutions and organizations. So all these things, I think, are how we sort of think very broadly about policy. It's critical to the work. Having said that, an example of maybe an area that we haven't been so explicit about, which Stacy mentioned, is housing instability. So we've been very focused on substandard housing for the last few years. But we realize that a lot of this is being driven by the kind of displacement we're seeing in cities across the country. And from a health point of view, the instability that that's creating, and from a human service point of view, the instability that's creating for families to either get healthy or to work is truly critical. It's at an emergency kind of level. So we want to see if there's policy solutions, because we cannot simply litigate our way out of each and every single case.
Great, thanks, David. There have been a couple of questions about will the slides be available, and just as a reminder, the slides and the recording of the webinar will be made available next week. Chris is going to answer a question for us about equity.
Sure. Thank you. So we've gotten a question about how Kresge, or perhaps the Kresge Health team, defines equity, and I'm going to try to address it both by talking about equity as well as health equity. And I want to first acknowledge that there's no one right answer to this question. There are a number of groups who have put a lot of thought into this, and if you search for definitions, you can find one from World Health Organization, APHA, a lot of groups. But starting with equity, I think one that we've referred to a few times has been developed by a partner of ours, PolicyLink, which is just and fair inclusion into a society in which we all can participate and prosper and realize their full potential, unlocking the promise the promise of the nation by unleashing the promise in us all, right? Which, I think we feel does a good job of summing it up. We did give some thought to this question as we were preparing for our strategy review with the board in terms of thinking about how we're defining health equity as well. And I can share a bit of the passage of what we developed. So we believe that race and ethnicity should no longer play a role in determining health status. We recognize that existing health disparities result from a deep and complex legacy of structural racism and biases that can be found in many sectors and systems upstream from healthcare, from housing to banking, criminal justice, land use, and education, to name a few. Achieving equity in health requires dismantling inequity in the systems that affect health. And we're very committed to that vision. Also want to recognize that in addition to how we're articulating equity from the health team perspective, Kresge is in the midst of a very deep enterprise-wide effort to put a more explicit racial equity lens on everything we do, and there are members of the health team who are involved in that effort as well. And I don't know if any of my colleagues would like to add to what I just shared. Thank you. Okay.
Wonderful. Great, so we've had a number of questions come in here, and just taking a moment to catch up here. There are a couple of questions more generally about the types of partners that we work with, and hoping if one of my team members can take a little bit of give people a sense of who we work with in terms of academic institutions, community-based partners, state-level efforts, national efforts, just kind of give folks a broad view of the types of partners that we work with.
Well, the answer is yes. We have partnered with all of them. I don't think just sort of a simple review of our grant portfolio would show that. I would say that maybe the best way to answer that is we see our grantees as partners. They're often thought partners. They're often organizations we work very closely with, especially on work on the ground, especially if we're working with place-based work. We often partner with an intermediary or other organization to help us really both manage and administer the program on the ground, such as in the Fresh Flow program. But we're also in the policy area we do work with several both national organizations as well as local organizations, around policy advocacy, policy analysis, demonstration projects, and things like that. So, everybody's essentially a partner in this view of trying to think about partnerships. But the question of how to become a Kresge partner, I think I will say that one thing that we will try to be accountable to ourselves for in the coming year is what are we going to try to achieve, in terms of really moving the needle around integration, around getting institutions to really invest in communities, and really identifying kind of the opportunities at the community level to drive real solutions on housing, built environment, and food systems. So that is where we're going to be looking at and trying to define not just anybody, but those who really are kind of going to be with us on this journey in the next few years to achieve these outcomes.
Great. Thanks, David. We have another question asking about some of our food systems priorities. I'm going to turn that one over to Stacy.
Thanks, Katie. This is a question about our goals in supporting access to healthy food as part of our new strategy. I think that you heard that healthy food systems has been a consistent determinant of health that we focused on for many years because we know of its significance to health, particularly in the communities that we are most concerned about. And I will say that Fresh Flow, the Fresh Local and Equitable initiative that you heard me describe earlier, is really probably going to be the crux of our work in healthy food systems over the next couple of years because it is a 3-year project. And we hope to really see a growth in food-oriented development and an increasing focus, again, on those models that are driven by community. So we also look at food policy as an issue, so you may hear from us around funding opportunities around food policy.
I would like to say just add a little bit that we see these issues, whether it's housing or food or built environment, as not simply just a community issue. That housing, for example, is the best example. Housing is both a community issue that we see solutions, especially around displacement, but it's an institutional issue because we see health systems and other institutional investors investing in housing to not just for more housing, but to produce health outcomes in communities. So hospitals are seeing housing as a health investment. And then we're seeing housing as a platform in integration, especially in things like permanent supportive housing. And in food, in many ways, has a similar kind of cross-cutting issue. It's on the ground. Institutions are using purchasing policies to purchase local foods, and how to integrate food security into clinical programs is also a critical piece of this. So we see these things as not simply within silos. They cut across several areas, and we will be spending some time looking at these issues across all of our strategies.
Great, thanks, David. We have a question related to our institutional investment strategy that I'm going to turn over to Chris.
Sure. So I had a question regarding anchor institutions and their role. And the question was actually framed, what is the anchor institution movement? Movement might be a bit too strong of a word, but I'll try to give a bit of context. So essentially, it's an awakening among a number of primarily universities and health systems at this point, but also some other institutions who are deeply rooted in place, that they have tremendous power, if they choose to use it, to actually improve quality of life in the neighborhoods that surround their institutions. And so I gave an example earlier with regards to Dignity Health, but I can give another one in Kaiser Permanente. So they prioritized a few years ago purchasing from local sources, whether it's food, whether it's services like laundry or whatnot, and particularly from small businesses that are typically not competitive for competing for these large contracts. Because it's very easy just for a large health system like Kaiser to contract with a broadline supplier like Cisco and be done with it, just write one contract. As a result, Kaiser now contracts $2 billion worth of services and purchasing from businesses owned by people of color and women who they're primarily smaller businesses, and their theory is that by doing so, they're not just improving the economy of the neighborhoods that surround their health systems, but they're improving health, because people who have better economic futures, better economic opportunities, tend to be healthier, right? So it's essentially enlightened self-interest. Kaiser Permanente is not alone. You could also point to University Hospital in Cleveland, Temple University in Philadelphia is doing some innovative work on this front too. So what we're trying to do is really accelerate this movement so that more institutions see it as their responsibility, not just to provide, in the case of hospitals, healthcare services, but also take broader responsibility for the health of their communities.
Great, thanks, Chris. We had a few questions about Kresge's work across the foundation and how we work across different teams. As Stacy mentioned, FreshFlow is an initiative through the health and arts and culture team. And as some of you might know, we do a fair amount of cross-team grant making. So I'm going to turn that question over to Chris, who is Kresge's cross-team grant making expert.
Sure.
For him to answer.
So be happy to. So about last year, about 25% of the grants that the Kresge Health team were made in partnership with other programs. So it's, and as an institution, Kresge, about 16% of our grants took the form of cross-team grants. We're increasingly looking for work at the intersections of our respective programs and practices, how we can work together to expand opportunities for people with low incomes in America's cities. One example beyond FreshFlow, which Stacy already articulated, is we're involved in a multi-funder collaborative called SPARK, which stands for Strong, Prosperous, and Resilient Communities Challenge. That's a partnership internally with Kresge's Health, Environment, Arts and Culture programs in American Cities practice, as well as externally with Ford Foundation, Robert Wood Johnson Foundation, JPB Foundation, California Endowment. And that's working in 6 cities. It's a $90 million initiative, and we could only get there through partnership, both internally and externally. That's at the major end of the scale. We also do cross-team grants that are more place-based, like Push Buffalo, which if you go to our website, you can learn more about them or just Google them. And that's going to continue to be.
Strategy is for cross-team.
Yeah. And the integration strategies will be cross-team with human services as well. So that's going to continue to be a hallmark of our work.
Thanks, Chris. Wonderful. So we're coming up to the end of our time here. Just a final call. If there are any last-minute burning questions, you want to type those in. I'm looking to the team if there are any final comments before we close it out.
People are all looking in my direction. But I again want to reiterate our appreciation and thank you for joining us for the past hour and some minutes. And just know that we'll probably continue to get questions fielded through our email inbox, right? And I don't know, Christina, if there's anything else.
Yeah, I'll provide some final kind of housekeeping remarks here. So again, we just want to thank you for your time and for your interest in the strategy and for all of your questions. We know that there were a number of them that we didn't get to, and some that we tried to lump together, but we'll be sharing a frequently asked questions document along with the webinar recording. So, and also if you didn't get a chance to ask your question, or if you have something that comes up as you're thinking about this later, please feel free to reference that document. And also dig into the information that's up on the website. And as we said, we're out and about, so please, let us know if you have questions that come up. You can also email the team at the inquiryhealth@kresge.org email address as well if there are questions that come up after the fact. So again, we thank you so much for your time and for your interest, and we hope that this provided you with some insight. We also, along with the recording, will be sending out a brief evaluation, and as Phyllis said, evaluation is central to our work here. We love learning from those in the field, and so if you can join us in kicking off our evaluation efforts with this first survey, we really appreciate it. So we're very thankful for your work and for your dedication to creating healthier people and communities and the partnership with the foundation. Have a good afternoon, everyone. Thank you.
Thank you.
Thank you.
Bye.